great, again, to have three very experienced and educated people in this realm. So I'm really excited to go through with this. Again, we're going to try and stick to this case base. And now we can use Lara's case still. Her injury, and she never really got into it so much, but it was a fall off the bike. But because it's a little more near and dear to my heart, let's go with soccer and Scott's. And we see all kinds of injuries out there. Every sport's going to have different risks and patterns to injuries, whether it be ankles, hips, and especially head and concussion. So let's first start off with, you're on a pitch and you're on the sideline and you see maybe not even like a head-to-head, but someone who just falls funny, okay? And, maybe it doesn't even look like that much, but you kind of look over and they're not getting up like they typically would. How does that go? What happens? What should happen?
Yeah, so you said it. There's lots of ways, I guess, that can be a head injury in soccer. Stopping them right away, getting their attention, seeing where they are. The first thing to me is a call out and see how they respond. If they're truly dazed, they sometimes can't even pick up where your voice is coming from. And I think that's your number one sign right there that something's not right and they need to stop.
Okay. Plays continuing on. Referee doesn't see what's going on and plays going on at the other end. Are you waving things down? How does that go?
Sometimes I can't get the match official to stop, but I can get the player to stop. So mine right away is my hands come up, freeze. I need you to stop. I need you to stop. Look at me. Focus on me. They're trying to get back into the game. Don't worry about the game. I want you to look at me. So that's my first command there. Usually by doing that, it starts to alert the referees or other people around that something might be wrong, and then you can get a game stop train.
Perfect. And then often they'll call you out onto the pitch. Okay, an official will go over, usually an assess, and say, "Come on out." What happens at that point?
Yeah, and usually me in the youth role, the college role, we have the athletic trainers will get to go out and do that, which is great. But even if there is a suspected injury of a head, whether it was a hard jar or they fell to the ground where they actually truly hit their head, it's let's stop, let's get you off the field, and let's get into a proper assessment with you. We can't be looking at and diagnosing a player on the field, determining going, yeah, that was a small bump in the head, you can keep going. No, it's a bump in the head, we're going to come off and we're going to see how you feel.
Okay. And obviously there's going to be some differences between Fleming, where there are athletic therapists there to go through that whole protocol, so the coach, the manager can continue working with the team. In the youth, that's not quite the case. They're going to want to start getting play going again, but you're usually you may or may not be by yourself. Maybe there's an assistant coach, maybe there's a parent that's involved in management. When do you make a decision, I guess, at the youth level, you can't go back out there?
Yeah, so...
and how does that work? How does that go? How do you navigate that?
Actually, very big difference between the youth and the college level. At the college level, that's actually an easier stop. It's often a harder hit and a doctor who's sitting there saying no. The youth level, they catch their breath, they have a squirt of water, and they want to go again. And you can tell that they're not right. You have them stand up, they seem a little bit woozy. Sometimes their color goes from their face. So there's usually a lot of symptoms and signs. I try to, myself or one of the coaches, start on a conversation. Tell me a story about, hey, what did you like about practice, and see where their speech patterns go. See if they're having trouble putting sentences together, thinking, collecting their thoughts. Usually when that starts to happen, you see other symptoms, like they might all of a sudden become queasy to their stomach. So that's the players. We're trying to delay to see what's going on. But almost always when there's a bit of bump in the head, we stop it right away. We'll tell them off the hop, you've taken a knock to the head. We don't know how serious this is. I know you want to get out there and play, but this could be worse. So we're going to stop and we're going to call it quits for today until we can see how you are over the next couple of days. Parents, you mentioned, that's a whole different story. You got parents coming across going, oh, they're fine. They're okay. They can get back out there and go. So addressing that, you and I were talking before, is that's a preseason conversation that parents, if I think there's been a hit to the head, that's my decision, not yours. So Can that be unpopular? Sure. You're in a tournament final or a championship game and it's 5 minutes in and they want their kids to be on the field. Yeah, they want their kids to be on there, but safety, you're on the side of safety is what I was going to say. And we take them from the game and say, I'm sorry, you're done until we can have proper evaluation done.
And nowadays we have, as coaches, we typically have a safety net and that there is policy, right? There are forms to fill out. There are rules that each club, each organization will have, right? And I find that very protective at times. It's easier for me as a coach to be like, no. This is what we're doing. We already have gone through this. We have these rules that need to happen. I'm finding being involved in different sports, there is a variety of how those policies are being implemented, how well they're being communicated to the different levels of organization. Now, Paul, I'd love to bring you in on this because this is your area, and I am actually excited to hear a lot of the policy stuff because I find that that's where we get greater change. Dr. Jorgensen's talk earlier was about this is how we make bigger change, right? So, can you tell us about what is supposed to happen across youth sport according to Rowan's law? What are we supposed to do if an official sees an injury, if a parent sees an injury, if a coach sees an injury?
Sure. I'll preface it by saying it's hard. Like, this is a really difficult space. And in sport, and maybe use some examples from rugby if I go through that process. And some sports are very well resourced and that they're able to use technology and with registration platforms, etc. And a couple of things, if I use rugby, for example, in rugby, there's a philosophy of being able to recognize and remove, and there's a shared responsibility that everyone has a responsibility to be able to recognize the signs and symptoms of a possible concussion and then remove that person. So there's a lot of education resources around coaches, officials, administrators, and athletes to educate themselves so they're able to identify the signs and symptoms of a concussion. And then maybe for rugby, if in doubt, sit them out is the philosophy. So our role or the culture that we try to create is you're suspecting a concussion. You're not diagnosing a concussion, but you've identified some signs and symptoms. What rugby's tried to do is also have incident versus signs and symptoms. And so quite often we see in sport that the incident, and then we start trying to look for the signs and symptoms of a concussion. So through the education's evolved in rugby, there is incident and signs and symptoms. So yes, there's big hits, and there's collisions, there's contact with the floor, but we're looking for the signs and symptoms there. And because of the mandatory education requirements, that everyone knows what the expectation is. If we suspect a concussion, if we're in doubt, then we're sitting the athlete out. Athletes removed from the field of play, and Dr. Jorgensen shared the blue card for an example. So anyone can remove an athlete from the field of play. The coach can remove medical if it's there, but should the referee suspect a concussion or identify signs and symptoms, they give a blue card. When that player comes off the field of play, then that's registered into a registration platform. And that's what separates it maybe from a lot of sports that don't have that technology, but that player would have a blue card. And then this is where maybe it's person power versus technology. The person then, or the parent or the person, will receive an email to say, you've been suspected of a concussion, here's the documentation, and here's the process that you need to go through. That person can then not be put onto a game sheet and participate until they've been medically cleared by submitting the relevant documentation. In rugby, that's done from a technology perspective, but that's where clubs would need to administer, or sport organisations would need to administer that piece. Communication is one of the biggest challenges for sport. Is the athletes came off, who do we need to tell? Who do we need to follow up? And what are we telling them? Telling them process, point them in the direction of resources as well. And so they would receive their email, and they would have to then go through and be assessed, preferably medically, assess to diagnose a concussion and then go through their return to play process and then be medically cleared, submit their documentation, and the club would then allow them to go back and play.
When we were talking the other day, when you introduced the idea of the blue card, it blew my mind. I feel like how have I not heard of this? I think this system is incredible because it's a system, and that's the most important piece, right? All of a sudden, there is documentation that's being sent to the league saying, "Oh no, you can't come back to play until these are filled out, and we've made sure that you're ready to go back." And I love that. I think over time, hopefully, we see that across more sports because we all have that technology. Like that's easy. That is an easy system to put into place. So that's great. Good for you guys for doing that. Is it well received? Is it in practice now?
Yes, it's in practice now. It helps when you see things on TV. For people that are rugby fans, they see on TV, they see the professional athlete take the blue card and the professional athlete's removed. So there's a general acceptance that it's the norm within rugby. But the blue card isn't the important piece. It's the process that there's a suspected concussion, person is to be removed from the field of play, then communication needs to happen to parents, to athlete, to schools, to workplace. Everyone has that shared responsibility to diagnose whether it's a concussion or not, and then return the athlete to learn or play or their workplace safely.
Okay. Now we've talked about it as professional. Is that being used at the amateur level, even locally? Are you the Pagans? Is that system in place?
Yeah. So again, it's fortunate from a sport perspective. If rugby, soccer, various sports have national registrations platforms, so it's a lot easier to integrate when you've got to submit a game sheet or you've got to register the participant on the platform. It's not foolproof, and people leave the sport, so they don't finish the return to play process, and then they could be participate in another sport, which is a big challenge that was identified when we done our work with Rowan's Law. Is sport sharing information, school sharing information. It's an individual, and there's information. It's hard to share information as well.
And that's going to be in our third talk. That's coming soon. The integration of it all, and you talk about we've signed off those forms as parents, as coaches. One of my frustrations is still that I find that there's been over the last probably 5 years, came out with a storm. People were right into Rowan's Law, and all the organizations were on top of it and realized the importance of this. And over the years, the simplicity has changed with regards to you just even with the school forums. Like I take off the blocks that I've read this form again, and I've read them once. I'm lucky I know about this stuff, but a lot of parents don't. And I think it is right now too easy to fall through those cracks, and that organizations aren't putting enough emphasis. They know that people aren't doing the work. In the past with soccer, we'd have to do the video, and we had all the patients do the CAD online, and you had to each participant had to do it. And then also the parents had to do one. And you had to print it off and show the organization. Yeah, I actually did this 40-minute course or whatever. And I thought that was appropriate, not too much. So anyways, that's my frustration and bias, and we'll get to yes.
I was just going to say, sometimes I think parents treat the coaches like we are doctors, and they're bringing them to us to have that look. I had a situation in the summer where one of our players at home banged his head on the wall or a corner of the bed or something, was dizzy for a couple days, and the parent brought him to soccer to see how he'd do. Right? I'm like, whoa, hang on a second. I think there's a problem here, and he needs to go through the process and be evaluated. Oh no, but it happened at home. But still, right? Like it seems like we can laugh at it. It seems simple, but that's where the parent's brain went. It was minor at home. Let's see how he does at sport, and then we'll get him checked out, right? So yeah. There's that, even though that education's out there, there's that still a little bit of a disconnect or misinformation, or maybe it's just an extra trusting on us or time.
Please.
And I'll come at it kind of from both sides of it, because I'm a physiotherapist. I diagnose people with concussion in the clinic, but also I'm a U10 sports hockey trainer for my son's hockey team. And I find it difficult, as with my background in physio and more knowledge in concussion than most, still super difficult on the field, or in this case on the brink or on the ice, to know, is this a concussion or not, right? And I'm thinking, I've got more background than most of the other OMAJ trainers, just being a physio. It must be super challenging if you have less background than that. So I think that idea of, if in doubt, sit them out, makes sense, because you don't have to know if it's a concussion. You just have to know that it might be a concussion, and you got to get them off and not let another potential injury happen, and then let them be properly assessed outside of the rink where it's a crazy space.
Okay, and what does that evaluation look like?
So then if I switch to my other hat in the clinic, I actually assessed a young boy this morning in the clinic for a suspected concussion on the weekend in hockey. This is hockey season in Ontario, so I've had 4 hockey-related head injuries in the last week. The good news with those is they've all come to see me within the first week, so that's a good sign. But those are also parents that have resources and have private benefits to go access physiotherapy. And they know that I do this type of treatment, so there's some knowledge and comfort with coming to see me, because maybe they've seen me themselves for another injury, or their other child. In the case of this morning, the older brother had already had a concussion and come to see me for a...
Is it genetic?
I can't answer that for sure. Probably a component, but I can't say more. But yeah, in the clinic this morning, the first thing was just to try to get an idea of, obviously, what was the story, what happened. In this, it was a kind of a typical story. Went into the boards hard in hockey on Saturday. The coach or the trainer knew enough to remove him from play, just based on what the hit looked like and how the player was complaining of a headache immediately after. So stayed out for the weekend, didn't play in their game on Sunday, which is very reasonable. And then luckily got in and booked a cancellation assessment with me this morning. Because like you said, often getting in within a few days isn't realistic. This one happened to work out well. But I think the big thing for him was, obviously we heard obviously really good firsthand account from Lara this morning of what it's like to go through this process when it isn't going well. But also on the flip side of it, a lot of people just get better really quickly, right? So this was an individual that appropriately was removed from play and went to school on Monday, felt normal, came to see me today, felt normal, and we got into starting some light aerobic exercise. It's kind of stage 2 of the return to play. But he's already kind of cleared the return to learn, because he's gone back to school the last 2 days and felt good yesterday. So they're not all concussions don't last long, is I guess what I'm trying to say, but some do. And you need to identify early on, as early as possible, who may fall into either category based on how they kind of present early on, and then how they progress through those early phases of these return to learn, return to play protocols.
And there is, I mean, it's beyond kind of this discussion, but there's certainly a lot of research looking into comorbid flags that would say, who is more potential for having a prolonged course than not. And that information is out there to look up. So imagine people who are doing that type of care should have that in the back of your head. Like, who, in a bigger picture, this client, this patient, who are we working with right now, and what kind of risk factors that we have for recovery? You mentioned, we've had quite a few in the last little while. Has there been an increase in frequency in people seeking out in the last, I don't know, since you started your practice?
Definitely since I started practice. For me, practice started in 2011, so like 13 years now of practicing as a physiotherapist. Definitely, I would say, like these gentlemen and the other speakers this morning, I think Rowan's Law did play a big factor. I think there was like a Sidney Crosby uptick about 10 years ago. That was a big factor for sure, because it was all in the media and the news. How can this star athlete be missing, the better part of a full season and having these recurrent injuries maybe there's more to this. So I think there are always things in the media that then bring out more people seeking help, for sure. But I would say in the last 3-4 years, I've noticed even a shift in parents in a positive direction. I know we've heard some, like, kind of the negative side of things where parents are like, get back out there, get back out there. But anecdotally, I've seen...
Those are just the ones that stick out. That's all.
Right, yes. And they do exist. They do exist. But anecdotally, I've seen a shift in the mindset of parents where they're taking this seriously. And they know the quicker we can get the appropriate assessment and get the right processes in motion, the better outcome my child will likely have. And I think there is, just from the broad media output of information, I think there's more of an understanding generally, definitely, than there was when I started practice.
Yeah, I would agree with that completely. You know, in my practice, we certainly see people more aware, and I'm probably telling more people, say, you know what, you're actually good, right? Like, which is appropriate. Like, you know, you're ready to go on to the next thing.
Yeah.
I'm glad you came back. Thank you.
Or you didn't have a concussion.
Or you didn't have concussion.
Right, I think that's super important. That the diagnosis of concussion by a medical professional is an important part of the process. And not everyone that hit their head or was a suspected concussion actually had a concussion. And like Shannon mentioned earlier, there's a lot of overlap of, if you go through like the SCAT, the Sport Concussion Assessment Tool, for example, and look at their symptom guideline, if any of us went through, like I was up at 240 watching the Jays lose last
Do you know what the date is? Do you know what the date is today?
I have a bunch of those symptoms right now, and I have not hit my head recently. So
You were doing
yeah, exactly. But not everyone who has a suspected concussion has actually had a diagnosed concussion. So I do really emphasize for parents, if able, again, mentioned, not everyone has the resources or a family physician or a nurse practitioner, but if able, getting that true assessment to determine did they actually have a concussion or not is a very important part of the process.
And they're also going to take, there's a level also of all these professionals that are working within, with athletes, with students, or anyone who could get injured like this. Their familiarity, and I can speak to like a lot of family physicians, you know, there aren't necessarily this, they you know, we're taught the basics when we went to med school, whenever that was. I think Vince said that I was 29, so what, 3 years ago? You know, things have changed, and there is not always the right information, and people who are familiar with it who are comfortable and have experience in treating and recognition. I think it's really important to have that type of involvement, because you were both talking about the recognition piece, and I was thinking about it. When you become good at something, yes, there's protocols and there's these details, but there is a component of like, oh, you just don't look right? And that's practice. When you've got having been on the pitch and at the rink with the Peds and seeing that glassed over look, I'm like, you're not quite the same. And it may not have been a big hit, and they might not have a ton of big stuff, but you're like, there is a component of, it's not just going to be a raging headache or a completely glass-eyed look or my neck is killing me. Sometimes it's very subtle, and you can't ignore that. I think anyone who's doing that type of recognition, we have to put that in. The more and more you are looking for it, the more and more you're going to see it.
Yeah, I was just going to make a point that I think that's quite interesting in this discussion is the focus on incident. And like my risk, I guess, is when you're a multi-sport athlete that could show that they could be doing physical activity at school, and then they're going to their club within an hour, and the signs and symptoms show up at the club, but there isn't an incident to kind of connect that to. And so I guess for me that the kind of real focus on those signs and symptoms piece rather than there was a big hit, because not all possible concussions come from a hit or a fall. So especially kids are playing as well, falling out of trees, doing silly things that they do. So just that real focus on know the signs and symptoms of a possible concussion and manage on it.
That's actually because I was reading something the other day, and I've heard it a number of times within concussion care in our elderly population, right? So 80-year-old comes in and they emerge with a lot of these symptoms, and they've had a fall. And I'll say it as my grandmother had one of these where she was told that she had dementia. This is 10 years ago, and she had a fall, and she was teaching the youngsters, the 72-year-olds, how to play bridge. And I'm like, no, you don't have Alzheimer's or dementia. You have a concussion. You're bruising down your side of your face, and you did have a big fall. And she did recover, but for a long time, she's like, oh my goodness, I'm losing my memory. So it's those symptoms, and it is important to put it into recognizing, because they may not be at that site, and no one may have seen anything. So
I think that's a good point too with the multi-sport athletes, because one of the four individuals that I'm talking about that I've seen in the last 4 clinical days, she played a high school rugby game in the afternoon and felt normal. Went and played a hockey game that evening, felt normal, and then was super dizzy and nauseous on the car ride home, and then woke up feeling terrible the next day. And there wasn't an incident that stuck out to her. She said, sure, I got hit a few times in rugby. And she kept bringing it back to rugby. I know that the issue was in rugby. And I said, how do you know? And she's like, I guess because I got hit, or I hit people in rugby, and there wasn't really much contact or not. But regardless, I think she's truly had a concussion. It doesn't matter exactly when it happened. Just the fact that it happened and that she's now seeking out the proper care for it is important.
Okay, so you've done your assessment. Now what? Can you talk to us a little bit about what that return to play looks like? I guess, and it's going to be different probably for different. There is an overlying protocol, but it might vary between sports. And how do you guide people so that, because we realistically, I can't see them back every day, right? But there should be an evaluation every day, right? So how do you educate people for that?
I think a big part of it is utilizing symptoms to track progress. So this idea of having a scale that you mentioned earlier, of like a 10-point scale, I think people can generally get the idea of, can I rate my headache 0 to 10, right? Like that concept is pretty well understood. Obviously, for a super young kid, you may need to get more creative than that. But for a teen, someone 12 and up, I think they can have a relatively good representation of how intense is their headache today, for example. So for example, this morning, in this individual that I assessed, it's then, he's had symptom-free days at school. It's time to start progressing back into being active again. So for us, that was riding the clinic today, getting on a bike, and cycling for 15 minutes at just a low intensity base, getting kind of reports from him in terms of any change in symptoms, as well as me kind of manually take heart rate and seeing, cause what can sometimes happen, for those that don't know, is that as heart rate elevates, symptoms can tend to elevate. So just getting an idea of that as well. And this individual did quite well, got through 15 minutes of light aerobic activity, and had no symptoms. So that's great. We kind of say check mark for that. We can move on to the next phase. So the phases that you're referring to, the stages of their turn to play, were mentioned earlier as well, with regards to the Lakefield College athletes. But essentially it's a 6-stage process of increasingly more difficult challenges as you work your way through that process. And trying to make sure that we limit the possibility of another head impact before it's safe to do so. So early things through those stages are very non-contact focused. And then as people are progressing through, starting to do more vigorous exercise, showing no symptoms, have returned to full school without issue, we can start to discuss moving later into the contact practice, and that eventually by.
And it's going to be individual. But generally, how long should this process take about?
So sometimes it's like there isn't a how long should it take, I guess is the main point of my story before I get into the rest of it. We've got some decent research to show that 75 to 80% of people get better, meaning they get back symptom-free within about a month. So we can confidently tell people most people within a month will be back to normal. That still leaves 20 to 25% that won't be normal, right? So it's still a high number. But I do think it's important to reassure people early on in the process that just like a bad ankle injury, a bad head injury improves, and the brain is very good at healing itself over time. So I think that reassurance is important. And then trying to throw timelines out the window. I actually sometimes find the ones like this morning trickier because he's totally symptom free 3 days later and they want to play Sunday, right? And they've mapped out, because my older brothers had the concussion before, they know the stages of the return to play. They know they go non-contact, they go more rigorous, that they go contact. Actually, he's got a contact practice on Friday night, so that one should be good. And then he's got a game Sunday. I'm like, whoa, let's pump the brakes a bit here. So I always say, like was mentioned earlier, I want someone to be symptom-free with all of those advanced stages for at least a week before we talk about contact sport. So we're not going back and playing even though he's symptom-free 7 days later.
Yeah.
Coach, to physiotherapist question.
Yeah.
Right on your point there, would you ever recommend a player go back to sport on a modified non-contact duty just to get out, get in for little runs? And Dr. Dallaire and I, we've talked about it, the social emotional factor of athletes is a huge thing too, right? So they're injured and they're out for 5 weeks, 6 weeks recovering. They're away from their peers, away from their friends. So just curious if that would be your advice to say if they can come out and do minimal activity, is it a benefit?
100%. I think the social piece is a huge piece. And I think some of the organizations do a really good job of that, some better than others, in terms of the individual sport organizations. For example, I've had some gymnastics athletes, and gymnastics, Canada does a good job of outlining, if they're at this phase, these are the activities at gymnastics specifically that they can do if they're in stage 3 of a return to play. And a lot of sports have a similar style of program. But for example, in this individual today, wanted to get back to doing some non-contact, like flag rugby, right, with Jim Lavas. And I, explained to them that's something that you will very likely get back to before you do a full-on practice. It's just we have to work our way through these phases, and that is a less risky activity than getting out for contact practice. But yeah, I do really, really promote the idea of having these, I say kids because that's what we're mainly talking about, but having these kids stay with their teams and stay with their social groups is super important to recovery.
Do you guys have any questions for each other at all? So that was good. It was a good one. That's why I was asking, do you have any more? Because that was fantastic.
I'd go.
Yeah.
How do you think so how often do in terms of like policy, how often does the policy adjust to the research?
How often, maybe you could change the question to whether it does or not. I think it's dependent on the sport. How often, obviously, when there's the international concussion symposium, potentially you see some policy changes there. If I use rugby, for example, I worked very closely with my team with Dr. Jorgensen, so our policies updated as the research kind of evolved. So at the end of the day, it's leadership. If the organization prioritizes the health and wealth of its participants, then policies will probably update when and as needed, I would say.
So, and that actually led to one of the questions I wanted to get to, because I think there's a difference between the rules of a sport and the culture of a sport. And what's easier to change? What do you think is easier to change?
Policy or culture? I mean, we talk about research, so that culture's long-term changes, isn't it? Say 5 to 15 years for culture to actually change. Culture is quite a fluffy word as well. It means different things to different different people. Policy is often that kind of punitive measure as well. And so sometimes the policy might be the lowest bar because it's what you're trying to get everyone to be able to do. So maybe the bar might be a bit higher than policy.
So I would say, for me, I'm thinking of culture as we all have shared and accepted beliefs, the same beliefs. And I would argue, and just thinking about it, I think that's a more challenging thing to change. How do we do that?
It takes time, I think. I mean,
Is it just time? Yeah.
yeah, I think it does take time. I think I think it's multifaceted as well. We quite often talk about performance or health, and it should be performance and health. Like the health of our participants and our athletes will lead to the performance outcomes that we're looking at. But there's we've all been in clubs or organizations where you have that kind of one person that really kind of drives the initiative forward. That makes a big change in PCs. I think we've got to create safe spaces for athletes, be able to build trust between the coaches and the people that are involved in sport with the athletes, where if the athlete is not able to share that they're injured, I think that's a big reflection of the culture. That clearly for me isn't a safe space where the athlete can go and speak to their coach. The coach has a responsibility to look after the welfare of all their participants and athletes. And that's got to be our primary focus of why people are physically active and participate in sport. So the coach has a responsibility there. So we've got to build that relationship, build that trust. How does that happen on conversations, team meetings, conversations as I think a coach can start coaching the moment that an athlete turns up at the field, the rink, having those conversations. If they're a little bit later, having conversations after. Keep building that relationship with your athletes so that there's trust there, that they can come to you and say, I need to talk to you. I think that would be a reflection of your culture when an athlete can come to you and say, I'm struggling here, but rather than have to be removed, when the athlete can self-remove. And I think that's a big reflection of your culture, but it comes down to your values, doesn't it? I mean, a lot of sports have values, integrity, being able to respect. It's quite disrespectful for a coach not to put the welfare of an athlete first. So we talk about being values led. I think there are sports like that, but I think there's pieces where officiating, if we've got sports where officials are being abused and we're seeing it on kind of social media, I don't think that's a safe space for athletes to be participating and physically active in sport. And probably when you see those environments where there's aggression and there's power imbalances, probably not a safe space for an athlete to say, "Might have a problem here, I need some help."
Scott, have you seen some change?
Yes and no. So I kind of chuckled when you asked that question. For me, I mean, soccer was a sport I got into because I didn't like to get hit. So I didn't want to play hockey. I didn't want to play rugby. I didn't want to play football. And then as I get older, I realized soccer is a sport where we kick the ball to the air and intentionally choose to head it, right? So, looking back now, probably was the wrong sport to pick. Or for those that know it, a corner kick play where 20 players stand in front of the goal. Well, we float a ball in there and intentionally try to use our heads to smash it into the net. Like it sounds silly. So from that perspective, I don't see the game changing. I guess from the policy side, I know there's been talk of trying to minimize using your head in soccer below the age of 12, for instance. There's no heading with the ball. And then they say, okay, 12, 13, teach it, but it's only 10 head bumps from a small distance and build up to it. So should we probably just get rid of using our head? Yes. But with the popularity of the sport and how it is, I don't see it happening. But from a health perspective, it should. Culture-wise, I think it's starting to get there a little bit more, especially with the younger ages. You just mentioned it. Athletes more often now are coming to us saying, I don't feel right. Something's bothered me, whether it's a knee, an ankle, a head, a neck, a headache, whatever it is. And I'm noticing that a lot more in the last, I would say, 5 years maybe, since maybe the post-COVID era, than going back 10, 15 years ago when players would just run through a wall and you'd find out a week later they had a broken bone in their foot or something like that. So I think that's maybe a slight change, but it's not a big change. Yeah. Though it should be.
Yeah. I share this with a couple of people too, and I think I think the time is a big thing, and just having the information out there, flooding, trying to get the right the good information, good education forward with our student population is a great place to start. If you think about smoking, I really think it's like smoking, and that we just don't have as much of a smoking population as we did 20 years ago. And that started when legislation came up and said, it started a policy. So you're no longer allowed to smoke in restaurants and bars and whatever. And then kids are taught in school, this is why we shouldn't smoke. This is bad, and here are the risks and stuff. And then they start getting older, and then they start sharing that information. And the people who are smokers and people who aren't, smoking is not a great example because it's not always a choice or not, but there's the addiction piece. But, for concussion wise, like, we can all think about that old coach you had, right? And we've all had them. And they won't be coaching necessarily in 20 years. And maybe that's where the change is going to be. And we've seen it in hockey. The sport has changed, right? And we're now promoting and encouraging that European style of fast hockey with lots of passes and quick moves, as opposed to the Rock'em Sock'em, which I grew up watching on video because it was an awesome thing to watch. And you're like, whoa, could you imagine having Don Cherry's Rock'em Sock'em on now? I don't think anyone would be like, we're watching what? So I think it's a time. Hopefully it's time. All right. Is there any questions from out in the crowd? Please.
I have more of a question. So speaking of what Connor was talking about with the 20% of young people that might not be getting better out of the same trap. Have you ever had that situation where maybe they don't want to play sport anymore? Because we don't talk about that. When we talk about highly motivated people keen to go back, maybe not telling their symptoms, like, can you walk through what that would look like and how you coach somebody? Because I think we never have talked about that group.
Yeah, I think that's definitely an under-recognized group of people, but they do exist. And I think, I'm thinking of an individual that I was working with last year, who was I keep going back to rugby, but was a high-level rugby player. But as we kept going and not really progressing as expected, in the same way that she was progressing in other facets of life, it started to kind of tip me off to, like, she didn't want to play rugby. Like, is this important to her? It's part of what she does. She's a student athlete. This has been her whole goal, is to build up to it. But when we got down to it, she's like, I don't think it's worth it. And I actually just asked, like, how excited are you to get back to rugby? She's like, I'm not. I'm doing all the things, the return to play, working with the physio, working with the massage therapist, working with the athletic therapist. But I'm not really looking forward to the actual outcome, which is rugby again. And that can happen for various reasons. You lost your passion for the sport. In her case, it was multiple concussions over a number of years that she was just fed up with not feeling good. But yeah, I think these people exist. And I think in that individual, then we needed to reframe what recovery looked like, because it changed the goal. Right. So the goal now is not about return to rugby. The goal is about return to what you are looking forward to in your life. Right. And for her, it was going to teachers college and prioritizing getting back to learning and feeling like herself again. And she said, I would love to, for example, coach rugby or play flag rugby, but, like, I'm done with getting hit in the head. And I do think these people are out there. And if we don't ask about them, we just expect everyone's excited to get back to this thing they've always been doing. We may be missing the goal of what the treatment is.
And I imagine there was a lot of mixed emotions for her to, like, various reasons why she's lost that passion.
Yeah. And
was it all fear, do you think? Or was there any part of fear of?
No, I think some of it, as we got more into it, was just she was done. you know, like she was like, and to some extent at high levels of sport, there is going to be natural burnout, injury or not, right? When you've put so many hours into this thing. So I think it was more of a case of burnout and less of a case of fear. I think fear was a component. She was done feeling gross the way she kept feeling every year she played rugby. And again, I think if we look back to her history, there were a lot of previous concussions that weren't managed well, similar to the story this morning from Lara, right? So in hindsight, maybe that would have changed her outcome, but this is where she was now, and it took me kind of taking a step back and thinking, like, what are we actually trying to accomplish here? And you know, in physio school, we always talk about being patient focused and goal oriented, right? And I started thinking, like, is this more my goal than hers to get her back to rugby? And I think it was. And then we just had to switch courses.
And I think that's a good check-in for everybody, right? Like, why are we doing this, right? What are we? One, when we're recognizing on the pitch, someone's like injured. Why are we doing this as coaches? Why are we doing this as players? And what are the goals going forward? So I saw another hand out there. Yep.
I have just something to add, kind of on that point that you were talking about fear. In the spaces that you guys are in, doing the return to play, and obviously as talked about return to learn as well, there is a component of the psychological recovery, right? We think about the fear component, your re-injury, especially with reoccurring concussions. And so within the space that all of you are involved in, what do you think your role has been potentially with like guidance towards psychological recovery, or where have you seen these other components come out as well during the recovery process?
Go on.
Yeah, I mean, I'm in a very privileged position where I work with high performance athletes, but our sports psych and mental skills coach is definitely working very hard when we have injured athletes. I think an area that's neglected is mental health when it's associated to concussion, but we've got a journey to go with concussion, but quite often there's a lot of discussions that happen and there won't be psych or there won't be mental health practitioners in the room. So I think it's an area that's really neglected from a sports administration perspective of where are those tools, where are those resources, and where can we signpost people to go? Because as I say, sometimes in sport we get really focused on returning to sport, but it's broader than just sport.
I think just to add to that, the idea of pre-existing mental health concerns, which are so common, having a concussion, having a brain injury can really limit the pre-existing coping mechanisms that you had. All right, so you were managing well with your course load, you were getting to practices, you were doing your early morning training, all of that was going well based on strategies that you had worked through, potentially on your own, potentially with the help of health professionals. And now those strategies have been disrupted, right? So something like pre-existing anxiety has now been very much exacerbated and is impacting your other symptoms like headache, dizziness, and sleep challenges, things like that. So it's this idea in concussion rehab of this like vicious cycle of mental health issues, flaring up symptoms, causing more concern and more challenges from a mental health standpoint. And like you mentioned, I think A, we have to just recognize that that's an issue, and then B, we have to try to sort out what we're actually going to do about it. I don't think we're there yet.
I think from a coach and an athlete perspective, concussions are the hardest of injuries because you can't see the symptoms. You sprain a wrist or an ankle, you tape it up and you try to get out and you play. So you've got athletes who are feeling pressure of, I'll use the college for example, it's a 6-week season, right? So they feel there's a timeline that they've got to rush themselves back to with a lot of injuries, and you can't do that with the concussion. They feel, okay, playoffs are next week, I've got to be back, I've got to be ready. I feel okay, I don't have any symptoms, except when I lay down at night on a dizzy, right? Like, that's the conversations they're having with you, and you can feel that they're just pressuring themselves to get in, which can lead to that anxiety, like you said, and that emotional distress as well too, which can be a setback, right?
Yeah, I think time of the season for an athlete is so important. It's very easy, relatively easy, for me to have this discussion with this hockey player this morning, and his dad being in the room as well, and say, I'm not comfortable with you playing next Sunday, regardless of how you feel the rest of the week, because it's the start of the season. But if that next Sunday is the championship game, that's a much more heated conversation.
Or I've even argue tryouts.
Yeah.
Right.
Tryouts are a huge stressor psychologically, which can then be a big stressor physically.
Can I add a piece to that?
Please.
I think that's where sport has to change, that there's so much pressure on tryouts. And so, Dr. Jorgensen talked about it before, but I think Ken Dryden talked about this before. Sport has to change. Maybe the framework of what a tryout is and how people access tryouts. Is it more important if we're putting the health first of our athletes? So maybe tryouts need to change. But I think that's the role of sports administrators. They've got to change their game and they've got to change their sport. This is it, but I think the connectivity that's lost, where we sports administrators, we're potentially the medical world, and we're not connecting. Maybe it's the research piece. We're not connecting the dots to say there's pressure here. Well, sport administrators can change the way that they do things to relieve some of that pressure, give up people other opportunities to access the sport rather than just this date for a tryout. If they've got a legitimate reason why they can we change how they access the sport.